Yeah, so the limit does not exist.
But I think when you do normally,
Hanif, did you try the new gym nearby?
Hanif, are you okay?
Do you even feel well?
Hanif, that's not normal. Are you okay? Maybe it's just tired.
No, this could be serious. I think he's having a stroke.
How did you know about this?
I learned about this before. Stroke symptoms come suddenly. Look, his face is drooping on one side. That's a big warning sign.
Hanif, can you lift both arms?
His arm is weak. See, this is one of the symptoms of stroke.
What should we do?
I'm gonna call the ambulance right now.
You should.
As you can see from the scene before, a person having a stroke may suddenly feel numb or weak on one side of their body, often affecting the face, arm, or the leg. They may struggle to lift one arm or feel as if it's unusually heavy. Other than that, their face may droop on one side, making their smile appear uneven. Also, they may have a trouble speaking or understanding speech. Their words might be slurred, difficult to understand, or they might not be able to perform sentences at all. Lastly, vision problems can occur, such as sudden blurriness, double vision, or even temporary blindness in one or both eyes. They may struggle to focus or see clearly.
What happened?
My friend and I were just casually talking, and suddenly my friend Ali started slurring his words, and all I know that his face started drooping also. He couldn't lift his arm properly.
You did the right thing for calling help. Those are classic stroke symptoms.
But what causes the stroke?
So, a stroke happens when the blood flow to the part of the brain is interrupted. This can cause the brain cells to damage because they don't get enough nutrients and oxygen.
There are four main types of stroke. First one is ischemic stroke. This type of stroke is the most common type of stroke. This stroke is caused by a blood clot or blockage in artery leading to the brain. The second one is hemorrhagic stroke. This type of stroke is caused by bleeding in the brain due to ruptured blood vessel. The third type of stroke is transient ischemic attack. This type of stroke is called mini stroke because it causes temporarily blockage that resolve within 24 hours and do not cause permanent damage. The last one is cryptogenic stroke. This type of stroke is a stroke with no known causes despite medical testing.
There are several factors that can increase the risk of stroke. There are diabetes, smoking, lack of exercises, and age. Smoking can damage blood vessels and causes blood to clot.
Eating unhealthy foods like donuts and cake can raise stroke risk by increasing sugar, which can raise blood pressure.
Hanif, let's go.
I'm so lazy. I can do it later.
Armin, do you know that lacking of exercise can contribute to obesity, which can also increase the risk of stroke? Hey, are you okay? As people get older, their risk of stroke increases as their blood vessels become less flexible, and they can develop a heart problem.
So, one of the ways to prevent stroke is by getting enough exercises. Exercises can help to lower your blood pressure. High blood pressure is a huge factor, doubling or even quadrupling your stroke risk if it is not controlled. High blood pressure is the biggest contributor to the risk of stroke in both men and women. Monitoring blood pressure, and if it is elevated, treating it it is probably biggest difference people can make to their vascular health. Next, quit smoking. Smoking accelerates clot formation in a couple of different ways. It thickens your blood and it increases the amount of plaque built-up in the arteries. Along with a healthy diet and regular exercise, smoking cessation is one of the most powerful lifestyle changes that will help you to reduce stroke risk significantly. Next, lose weight. Obesity as well as the complication linked to it, including high blood pressure and diabetes, raises your odds of having a stroke. If you are overweight, losing as little as 10 pounds can have a real impact on your stroke risk.
Ischemic stroke. About 87% of stroke are ischemic. The blockage in the brain is usually caused by a piece of plaque or even a blood clot. If the blockage occurs locally in the brain, the condition is called thrombosis, but if it's the body, it's called an embolism. Ischemic stroke are classified specifically based on where in the brain that the blockage occurs and where in the body that the embolism develops. For some cases, the location of original embolism is not known. An MRI study shows that as many as 40% children with sickle cell disease have had a stroke, even though the medical exam does not show any signs of one. The only treatment for this undetected stroke is to receive blood transfusion. A TIA, transient ischemic attack. It caused by the blockage in the brain, just like an ordinary ischemic attack. But with a TIA, the blockage breaks up before there is any damage to your brain. But it is typically lasts less than an hour, but can come and go. A TIA also called a mini stroke. A person who develops a TIA needs care as soon as possible.
Hey, Arnie, do you know what happened after I fainted the other day?
Oh, the doctor said something like this. Oh, he thought my friend having ischemic stroke.
Your friend condition is called TIA, which is transient ischemic attack. This is caused by blockage in the brain, but may last for less than an hour.
I see. So that's what happened.
Oh, nice. Okay.
So stroke can happen to anyone. So let's practice a healthy lifestyle.
Yeah!